Hi, I'm Dr. Bita. I work at Center for New Medicine for the past 9 years. I am a medical doctor. Today, I'm going to talk to you guys about labs. What labs to ask your primary care to order for you. So, one of the most important labs that a lot of doctors order is CBC, which is your complete, it's your white blood cell, red blood cell, platelet. So what does that tell us? So white blood cell, which is WBC, will tell us about your immune system, how your immune system is doing. So if you see history of drop in your white blood cell, like let's say 10 years ago, your white blood cell was 8, 7, and it's slowly dropping down to 6.8, 6.5, 5, 5.5, 4, 3.8, 3.2. It could be sometimes be within the normal range because ranges now varies from 3.5 to 10, but it's not good. You don't want to see that drop in your white blood cell. So what does that mean? That means your immune system is weakened. That means something is going on that your body cannot handle it. So then I look at the distribution in your white blood cells. So it's divided into lymphocyte, neutrophils, eosinophil, basophil, and each of them has a meaning to us. So that's an important one because if your lymphocyte is too high and you see your neutrophils is low, the percentage, that means you have overgrowth, you have a lot of viruses in you that your body cannot handle it. Then I would do vital panel on my patient to see what kind of viruses they have. Like look for herpes type 1, type 2, look for CMV virus, herpes type 6 virus, looking for Epstein-Barr virus. All these viruses can tell us something. It could mean that you've been exposed to it, but viruses can affect our cell, can suppress our immune system. So it's important to know that because if you do have a lot of viruses, that then you could take natural herbal stuff to help your body fight it, or do IV vitamin C, or be on high dose vitamin C, or do ozone therapies. There is a lot of things you could do to get rid of those viruses. So then we look at the next thing on that CBC, we look at your hemoglobin level, which is your red blood cell. So hemoglobin also, you want to have a good value. You don't want to have too much. That means then you have too much hematocrit and your blood gets thickened. And what does that mean? You're high risk of blood clot now. And then if you have too little of it, what does that mean? That means you may be anemic. It could be iron deficiency, or it could be, you're losing blood. So that's important to rule out. Make sure you have your colonoscopy done. Now, age recommendation for colonoscopy is 45 because of that's such a high colon cancer now because of our diet, lifestyle, constipation. Why is constipation a risk factor? Constipation is a risk factor because you are absorbing all the toxins. So you will have excess estrogen, xenoestrogen, environmental estrogen that can put you high risk of colon cancer and even breast cancer. So that's why it's important to have good bowel movements a couple times a day. So then your hemoglobin, after that, what we look at your platelet. If the platelets start dropping, I had patients start dropping platelet and doctors couldn't figure out why is the patient platelet dropping. Then I did heavy metal on them. He had a lot of high metals. So then we got rid of the metals and his platelets started recovering. So just one thing you guys need to know out there is a reason for everything that happens in your blood, or if you have symptoms, don't just ignore it. It's a sign of something is going on. And if you ignore it chronically, keep ignoring it, it leads to problem. So then another thing a lot of doctors order is CMP. Instead of CBC, it's CMP. So CMP is complete metabolic panel, which is checks for your kidneys, check for your protein, checks for your bilirubin and liver function. Those are important to do. A lot of people will have maybe normal, all of the level of their liver enzyme may be normal, but it may be low. If you have low alkaline phosphatase, that means you are low on vitamins. You may be low in zinc, you may be low on other vitamins. So what do? Then I tell patient, we should do a vitamin testing on you. You may be low on vitamins. I want to know why, what it is. So we do vitamin testing on those patients. Then if your bilirubin is, for example, elevated with no reason, a lot of doctors are calling it Gilbert syndrome. And that's asymptomatic elevated bilirubin. But believe it or not, I reverse a lot of them by putting patient on supplement for it. And that will help the liver and bile detox better, and you will detox your estrogen better. Another blood work that I do is total estrogen and estradiol, both in men and women. Some men may say, oh, I didn't know I have estrogen. And that's because men think they just have testosterone, but you do have estrogen too. And if patient become overweight and they have a big belly, their estrogen goes up because your fat produces estrogen. So that's why it's an important factor to do. And estrogen can promote growth. So it can increase risk of breast cancer, colon cancer, lung cancer. A lot of cancers is now linked with elevated estrogen, even prostate. So you want to make sure your doctor do your estrogen, do your testosterone. Even if you're a woman, you want to make sure you do have testosterone. That's good for overall well-being, libido, your muscle mass. If you're a guy, you're like, you know what, I don't know why I'm not gaining muscle. I'm lifting, it's just because your testosterone may be low. So make sure you check your testosterone. Another test is DHEA, which is your adrenal. Adrenal plays a key role. Majority of our patients, even myself, we tend to have low adrenal because of all the stress we go through, because of the work and daily. So anyways, DHEA plays a key role. You want to make sure if your adrenal is low, the problem is the range. The range is from 60 to 250. And that's a big range. So that's important because you want to be higher. If you're a man, young guy, if you're, 20, 30s, 35, you want to be having like DHEA over 300. If you're a woman, young, you want to be 200s. But if you're older, your DHEA will go down, but it shouldn't be less than 150, men or women, whatever age you are. It's best to be, your higher you have, your better adrenal and immune system you have. So DHEA does play a key role. And ferritin, I forgot to mention, I haven't mentioned that yet, is another marker with the big range. Ferritin is a stored iron level. So ferritin range could be in your blood work from 10 or 20 till 250 or 350 normal. And what's the optimal level? Optimal level is from 70, 80 to 150. You want to be in that range. If you're less than 50 and it still may be within normal range in your blood, that causes hair loss, causes fatigue, shortness of breath, cold extremities, and ferritin plays a key role in terms of carrying oxygen around your body. So that's why it's important to have high level of ferritin, otherwise your body will become hypoxic. So, and if you have too high ferritin, more than 150, which you may not red flag you say high because of such a huge lab range, then that means iron becomes oxidized in your body, it becomes like free radical. That's why it's important to make sure you measure you're not more than 150. If you are, may want to cut your animal product. You may want to avoid using cast iron. Cast iron is good for people with low iron to use it, but not good for people with high iron because it will add excess iron to your food. And some food like kale and spinach will also have high iron. So then you look at the iron saturation, iron level. Sometimes doctors just do iron. That doesn't tell us much, so it's important, make sure they do check for your ferritin level. And then iron saturation is important to be higher to 25 to 35, 40 is good. You don't want to be high side, 45, 50% and higher. That's abnormal. And then another marker that is important is Hscrp. That's a high sensitive C-reactive protein. It's a marker of inflammation in our body. It's not just a marker for your heart. It's a marker of inflammation. So the higher it is, that means the more inflammation you have. And sometimes a lot of cancer patients will have elevated CRP. And it's hard to bring their inflammation down in the body. And sometimes people start having CRP climbing up. It goes 1, 1.5, 2, 2.5. That's not good either. You'll be high risk of cancers and high risk of heart attacks, any kind of chronic disease. So you don't want to have elevated CRP, and we have treatments for it. We may put you on omegas, we may do food allergies, we may get rid of the metals. We look for why is the patient inflammation high. We may put patient on vegan diet for a while to see if that helps for temporarily, and then you could start adding meat to your diet. Another number I look at is hemoglobin A1c. Hemoglobin A1c plays a key role, the sugar. You know, a lot of us want to be on anti-aging diet. So anti-aging diet is key, is having low sugar. Hemoglobin A1c, optimal is less than 5.2. But what is range? Range goes from 4.7 to 5.6 is normal. And if you're 5.7 and higher, they may say pre-diabetic. But that's ideally your optimal level should be 5.2 and less. Usually I keep mine 4.7, 4.8, 5, less than 5 is the best, especially if someone have cancer, you want to be less than 5.0, because each time when you activate your, when you eat something, let's say I eat something sweet, if my sugar spike over 100, I activate my insulin, and that insulin is not good for my body to be constantly activated. So you want to make sure you consume food that doesn't activate your insulin, meaning spike your sugar too high at once. Let's say if you want to have fruit, sometimes if fruit spike your sugar too high, you may want to add fat to it. Adding like having apples with peanut butter or almond butter, some sort of butter and fat to not spike your sugar too high. And it depends. If I eat an apple, depending on my gut bacteria, it may not spike my sugar that high as if you eat an apple. If you eat an apple, it may spike your sugar over 100, but if I eat, it may be 80. So it all depends on your gut bacteria. And a study in Israel just came out this year that microbiome can even reverse the cancer, gut bacteria. So what they did was they had stage 4 melanomas who passed away, who didn't respond to immunotherapy drugs. And then they look at their stool microbiome, and then they compare it to people with stage 4 melanomas who responded to therapy. They look at that microbiome, and they saw totally different kind of species of bacteria and ratio. So what they did fecal transplant. They got that fecal and that healthy stage 4 and put it on someone who's not responding to treatment, and they had 30% respond. So it just shows you how important our gut bacteria is and how diet is linked to it. Let's say if you eat a lot of red meat, a lot of eggs, a lot of animal product, you're going to produce a lot of sulfur in your gut. And if you have bacterial infection in your mouth, there is a lot of positive anaerobic or aerobic positive bacteria, and that's not good either. You want to have a negative anaerobic in your gut that produces hydrogen. So there are tests that we could do to see how is your microbiome in your gut. Do you have overgrowth of bad kind of bacteria or not? So gut does play a key role in your healing. Unfortunately, on a regular blood work, you cannot do it. But I think it's important to do some sort of stool testing to figure out the microbiome. Testing is the cholesterol. You could do lipid panel. But cholesterol is not really, if your cholesterol is elevated, let's say if you have cholesterol of 250, but you have very low inflammation, very low sugar, you don't need to be worried about cholesterol. cholesterol is not the bad thing for us. Usually high sugar, high inflammation scratches all blood vessels in the body, in our body, and then bleeding happens. Then cholesterol goes to stop that bleeding, and that blood vessel, it forms a plaque, and that plaque is the problem. Yes, but cholesterol is just doing its job to stop the bleeding. So you need to bring the sugar and inflammation down so you don't scratch your blood vessels. So that's why the main enemy is the sugar and inflammation, not the cholesterol. So cholesterol, bringing cholesterol too far down, like less than 150, your total cholesterol is not necessarily good for you. You're shrinking your brain. What's your brain made of? Cholesterol. So you develop dementia, memory loss, memory problem. So don't think taking all these cholesterol medicine, your goal should be bring your cholesterol down. No, your goal is focusing on your sugar. When sugar goes down, most of the time cholesterol goes down. But let's say you have a familial, a lot of people out there say, oh, it's genetic, my mom has it, my dad. Some of those people are genetic, some they have it because of their lifestyle. But let's say if you decide to be vegan, and your cholesterol still doesn't go down. You're like, you know what, I done genetic testing, I have this gene that it is genetic, then yes, do take cholesterol medicine. Don't have your cholesterol too high up there. But just know cholesterol is not the enemy. Cholesterol is good for us. All of our hormones in our body, like estrogen, testosterone, pregnenolone, your thyroid, everything is cholesterol based. You need that cholesterol. So, and then LDL, I think the good number for LDL, usually 100, between 100, 130. Now, a lot of doctors are saying, if you had heart attack, it's different. They're saying less than 70, but don't bring your total cholesterol too far down. HDL, they call it the good cholesterol. HDL, it could be over 60 is good. That means if you exercise, if you take omega-3s, your HDL is usually 60. And close to 60, that's a good number. You want it to be high, 60, 70, 80, 90, but you don't want it to be over 90. That's not good either. Then I have a treatment for that to bring that HDL down. And thyroid, I didn't talk about thyroid, is very important. Sometimes though, your thyroid may be within range because range is so big. It's like from 0 point something to 4 is normal, less than 4 is normal. That's a big range. Optimal TSH should be 2 and less. And then your T3, you want to make sure your doctor does free T3. That's what your body uses. Total T4, T4 tend to be protein bound and free T4, but your body does use T3, so you want to make sure they check your free T3 level. But let's say your thyroid is within normal, but you still have the symptom. You're like, I'm constipated, I'm losing hair, I feel fatigue, I'm sluggish, my memory is being affected. Sometimes you could have functional problem, like numbers may look good, but your thyroid is not functioning right. Your body temperature is low. If the body temperature is low, that means your thyroid is not functioning right, because iodine plays a key role for your thyroid. Selenium plays a key role. And then progesterone help with absorption of thyroid. And that's a good blood level to check. And progesterone level, you want to have good amount of progesterone. A lot of miscarriages is happening in young girls because they don't have good enough progesterone level. Optimal progesterone should be like 10 to 15, at third week of your cycle. So you want to make sure you measure that, make sure you have an optimal level of progesterone. And if it's too low, it can cause miscarriages. So, but we know number one cause of miscarriage is genetic DNA defect. So, but other causes could be that. So you want to make sure men have progesterone as well. So then another thing, vitamin D that we could do on a regular blood work. Vitamin D plays a key role. It plays a key role in our immune system, in fighting for virus, like for COVID now. You want to make sure you take high doses of vitamin D. But you have to remember, vitamin D is fat soluble. and you have to take it with food, fatty food, to get it absorbed. And vitamin D, you could have your doctor check your D2, which your body produces, and D3, which is an active form. Your vitamin D3 get activated when sun hits your skin and body, and then it activates your D3. But the problem is, even living in sunny California, we don't get much sun because of the clothes we're wearing. So it's important, yes, to be out in the sun, but a lot of us are D deficient, believe it or not. And D has a big range. The range goes from 20 to 100. What's the optimal level? Optimal level is from 70 to 80, 85. You want to be towards high side. So if your D3 is low, you want to make sure you supplement. Sometimes supplementing patient with D3, it elevates their D2 as well. Sometimes they are on D3, their D2 is still low, then I give them some D2. So make sure you check both of the Ds. And then pregnenolone is another hormone. It's hormone of anti-aging. Cholesterol becomes pregnenolone, then it becomes adrenal, testosterone, estrogen, aldosterone, cortisol, all your stress hormone. So it's important to do pregnenolone level 2, but sometimes, unfortunately, insurances doesn't cover it. You have to pay a little bit out of pocket depending on your insurance plan. But other than that, most of those blood work I told you, if you you may need, depending on your insurance plan, some are covered or not, but it's important to know those levels because your health is your priority. And then let's say we do our blood work and everything looks normal, but we still have problems. So then we have a practitioner here who does Bioemu Survey. She's a trained doctor by Chinese doctor. She used to travel back and forth a lot to get trained. She checks your acupuncture point. She checks where the blockage is, what's going on in your body. Your blood work looks good, your vitamin looks good, your metal you don't have. What is it again? So then she checks, she says, you know what, you have overload of toxins. She says you have overload of parasite. A lot of us may have parasite and not be even aware of it. One way you could know if you have parasite or not, pay attention on your symptom. See if it's full moon and new moon related. If a day before full moon or if day of full moon you have symptoms, cannot sleep or get bloating or have any kind of symptom, rashes that flares up, that may be you have parasite. So anyways, we do Bioemu Survey to look for stuff that we can see on a blood work. I hope it was helpful. Thank you for joining me.